Before you scroll away, I need you to hear this carefully, because the information in this video could protect your life or the life of someone close to you. Right now, a dangerous virus is quietly spreading across parts of the United States and other regions of the world, yet many people still know almost nothing about it. It is not being discussed enough in clinics, and most media outlets are barely mentioning it. Meanwhile, more and more people, especially adults over 60, are ending up in intensive care with very little warning. The virus is called hantavirus, and today on NanoNexus Science, I am going to explain exactly what it is, how it enters the body, what happens once infection begins, and most importantly, the steps every older adult should take immediately to lower their risk and protect their family. If you are new here, welcome to NanoNexus Science. I have spent years researching how illness affects the human body, especially how aging changes the way we respond to infections and disease. What I am sharing today is extremely important. According to reports from the Centers for Disease Control and Prevention, the most severe form of hantavirus infection, known as Hantavirus Pulmonary Syndrome, carries a fatality rate ranging from nearly 40% up to 50%. In simple terms, almost half of the people who develop the serious lung-related form of this disease may not survive it. And one of the biggest concerns is that adults over 60 are among the most vulnerable because the immune system naturally weakens with age. Before we continue, I want to hear from you in the comments because I read them all. Tell me your age and whether you have recently spent time in places like a shed, barn, garage, attic, garden area, cabin, or any location where mice or rodents may have been present. Many people do not realize how common exposure can actually be until they stop and think about it. In this video, I'm going to walk you through everything step by step. We will cover what hantavirus is, how it spreads, how it attacks the body, real cases that have been reported, and the most important protective actions you can take right now. We are counting down from 5 to 1, and I strongly encourage you to stay until the end because the number one prevention step is something very few seniors are doing, even though it could make a major difference. So what exactly is hantavirus? Think of your body like a large city. Your immune system acts like the security team protecting every area from danger. Now imagine an intruder so small and efficient that it slips past defenses unnoticed, enters through the lungs, and begins targeting the systems that keep you alive. That is essentially how hantavirus operates. Hantavirus is a single-stranded RNA virus. That means it carries its genetic material in a form that allows it to invade human cells and force those cells to create more copies of the virus. It belongs to a larger virus family that has existed for thousands of years, mostly living silently within rodent populations. In North America, the main carrier is the deer mouse. Interestingly, these rodents usually do not appear sick at all. They continue living normally while spreading the virus through saliva, urine, and droppings into the surrounding environment without any visible signs. There are several different strains of hantavirus found around the world. In North America, the strain most often linked to severe respiratory illness is called the sin nombre virus, a name that translates to the virus with no name. Scientists first identified it during a deadly outbreak in 1993 in the Four Corners region of the American Southwest, after several previously healthy young adults developed a mysterious and severe respiratory illness. In South America, another strain, known as the Andes virus, has caused outbreaks in countries such as Argentina, Chile, and Brazil. What makes this strain especially alarming is that it is the only known hantavirus strain capable of spreading from one person to another through close contact. In Europe and Asia, other strains can trigger a disease called hemorrhagic fever with renal syndrome, which mainly attacks the kidneys instead of the lungs. Despite their differences, all of these strains tend to exploit weaknesses in the immune system, making older adults particularly vulnerable. Now let us talk about how this virus spreads, because this is where people often underestimate the danger. The primary route of infection happens through inhalation. Infected rodents leave behind urine, droppings, or saliva in enclosed areas like garages, basements, attics, storage rooms, cabins closed for months, sheds, or even old vehicles. Over time, tiny virus particles attach themselves to dust in the environment. The danger begins when someone enters the area and disturbs that dust. Sweeping, cleaning, moving boxes, or opening long unused spaces can release contaminated particles into the air. Once inhaled, those particles travel deep into the lungs, where infection can begin. Research has shown that under cool and dry conditions, the virus may remain infectious in the environment for several days or even longer. There are also secondary ways the virus may spread. A person can touch contaminated surfaces or nesting material and then accidentally touch their face, eyes, or mouth. Rodent bites can also transmit infection, although this is less common. And as mentioned earlier, the Andes strain has shown evidence of person-to-person transmission in certain cases, which is why researchers continue monitoring it closely. Now here is something every adult over 60 needs to understand. As we age, the body's natural defense systems become less effective. Inside your airways are microscopic hair-like structures designed to trap harmful particles and push them out before they reach deep lung tissue. Over time, this protective system slows down significantly. Studies suggest that after age 65, this clearance process may decline by 30 to 40%. That means particles that a younger person's lungs might successfully remove can travel much deeper into the lungs of an older adult. Once hantavirus reaches the tiny air sacs responsible for oxygen exchange, it can begin causing severe inflammation and life-threatening respiratory damage. This is one of the main reasons the virus can become so dangerous so quickly in aging individuals. What actually happens after hantavirus gets inside the body? This is the part that people need to understand because the progression of this illness can move from mild symptoms to a medical emergency frighteningly fast. One of the most dangerous aspects of hantavirus is the incubation period. That is the time between exposure and the first noticeable symptoms. In many cases, symptoms do not appear for 1 to 8 weeks after exposure, although most people begin feeling sick somewhere between 2 and 4 weeks later. During that silent period, a person can feel perfectly normal while the virus is already spreading inside the body unnoticed. The illness usually begins with what doctors call the early or prodromal phase. You can think of it like the calm before a major storm. For several days, usually around 3 to 5, the symptoms resemble a common viral infection. Fever, exhaustion, body aches, headaches, dizziness, chills, nausea, and sometimes vomiting are common. Many people feel pain in the larger muscle groups, especially the thighs, hips, and lower back. At this stage, most people would never suspect hantavirus. Even healthcare providers may initially think it is the flu, COVID, or another routine infection unless they specifically ask about rodent exposure. Meanwhile, inside the body, the virus is multiplying rapidly within the endothelial cells, the thin cells that line blood vessels throughout the body. As the virus spreads, those blood vessels begin losing their ability to hold fluid properly. That is when the situation becomes extremely serious. Usually, within 4 to 10 days after the first symptoms appear, the illness can suddenly shift into what is known as the cardiopulmonary phase. This is the stage where many patients end up in the emergency room fighting for their lives. The blood vessels inside the lungs begin leaking fluid into the tiny air sacs responsible for oxygen exchange. Healthy lungs are supposed to remain light and open, but with hantavirus, they slowly begin filling with fluid. Breathing becomes increasingly difficult very quickly. Patients often describe it as an overwhelming feeling of suffocation, or an inability to pull enough air into their lungs. Oxygen levels start dropping fast. Blood pressure falls. The heart struggles because the body is no longer getting enough oxygen to function normally. This severe condition, called Hantavirus Pulmonary Syndrome, can escalate from mild breathing difficulty to full respiratory failure within just 24 to 48 hours. Many patients require immediate intensive care, including oxygen support and mechanical ventilation. That is why early recognition matters so much. Once severe breathing problems begin, the condition can progress with terrifying speed. For those who survive this critical stage, recovery can still be long and difficult. Patients often enter a recovery phase where the body slowly removes excess fluid from the lungs through the kidneys. Some people improve within weeks, but others continue dealing with fatigue, weakness, and reduced lung function for months or even years afterward. One of the hardest realities about hantavirus is that there is currently no specific antiviral medication approved to cure it. Doctors cannot simply prescribe a pill and send someone home. Treatment focuses mainly on supportive care, such as oxygen therapy, ventilation, careful fluid management, and monitoring inside the ICU. In other words, prevention remains the most powerful defense. And this is not just a theoretical danger. Real people have gone through this exact nightmare. Back in 2012, a hantavirus outbreak linked to Yosemite National Park shocked public health officials across the country. Several visitors who stayed in tent-style cabins later became seriously ill. One man in his 30s developed severe respiratory failure only weeks after returning home. Out of 10 confirmed infections connected to the outbreak, 3 people died. Investigators later discovered rodent infestations hidden within the cabin insulation, which allowed virus particles to spread inside enclosed spaces. Thousands of park visitors had to be contacted and warned about possible exposure. Another reported case involved a man in his early 60s from Washington State who spent a weekend cleaning an old, unused barn on his property. Because he had done similar work many times before, he wore no respiratory protection. Within 2 weeks, he became severely ill with what initially felt like a bad cold or pneumonia. His condition deteriorated rapidly, and he ended up on a ventilator in intensive care. Although he survived, recovery took many months, and his breathing capacity reportedly never fully returned to normal. In South America, outbreaks involving the Andes strain have been even more alarming because this version of the virus has shown evidence of person-to-person transmission. In Argentina, a major outbreak resulted in multiple deaths and even infected healthcare workers caring for patients. Cases like these are why global health experts continue monitoring hantavirus very closely. In states like Colorado, Utah, and New Mexico, sporadic cases continue appearing almost every year, especially during warmer months when rodent populations increase and more people spend time in garages, sheds, cabins, and outdoor structures. Several recent cases have involved adults over 65, and not all survived. Now let us move into the practical side, because there are important steps every adult over 60 should take immediately to lower their risk. Number 5 is performing a full rodent inspection of every enclosed space around your property this week, not someday later. Check garages, attics, storage rooms, sheds, basements, crawl spaces, barns, and unused vehicles. Look for signs like droppings, shredded nesting material, chew marks, greasy trails along walls, or strong, musty odors that often signal rodent activity. But here is the important part. Do not rush into enclosed areas carelessly. Open doors and windows first and allow fresh air to circulate for at least 30 minutes before entering. If you notice signs of rodents, never sweep or vacuum the droppings, because that can launch virus particles directly into the air. Studies in some rural regions have shown that a significant percentage of deer mice carry hantavirus. And as the body ages, the immune system's first response defenses become much less effective than they were decades earlier. Older adults simply have less room for error when dealing with infections like this. If possible, do these inspections with another person nearby. That way, someone can help if breathing issues or dizziness suddenly occur inside a confined area. Number 4 is using proper protective equipment. And this is where many people make dangerous mistakes. If you enter an area with possible rodent contamination, wear a certified N95 respirator, not a cloth mask or loose surgical mask. An N95 is designed to filter tiny airborne particles much more effectively when fitted correctly. You should also wear disposable gloves to avoid direct contact with contaminated material. In heavier infestations, disposable protective clothing or old clothes that can immediately be washed in hot water are strongly recommended. Some people think this level of protection sounds excessive just for cleaning a garage or shed, but the reality is very different. The cost of proper safety equipment is small compared to the physical damage caused by severe hantavirus infection. As we age, lung reserve naturally decreases, meaning the body has less capacity to handle respiratory stress than it once did. Ventilation is equally important. Before entering contaminated spaces, open every possible door and window and allow fresh air to move through the area for at least half an hour. This can significantly reduce airborne viral particles. Now here is number 3, and this is the mistake people make more than anything else. Never dry sweep rodent droppings. Never vacuum them. Never use a blower. Those actions can turn contaminated material into an invisible cloud that gets inhaled directly into the lungs. Instead, health experts recommend soaking the area thoroughly with disinfectant first. You can use a commercial disinfectant or a bleach solution mixed with water. Let the area stay wet for at least 5 minutes before touching anything. Then, while wearing gloves and an N95 mask, carefully wipe up the material using disposable towels and seal everything inside a plastic bag for safe disposal. After everything has been cleaned, the used material should be sealed inside one plastic bag, then placed inside a second sealed bag before being thrown away in a covered trash bin. Any surface where rodents may have traveled should also be disinfected thoroughly using the same bleach mixture. Hard floors should be mopped, and carpets should ideally be steam cleaned whenever possible. The reason this wet cleaning method matters so much is because it dramatically reduces the chances of virus particles becoming airborne. According to public health guidance, damp cleaning methods can reduce exposure risk by up to 90% compared to sweeping or vacuuming dry droppings. For older adults, this is not just a recommendation. It can be the difference between a manageable situation and a potentially life-threatening exposure. And before we continue, if you are finding this information helpful, take a moment to support NanoNexus Science by liking this video, subscribing to the channel, and sharing it with someone you care about. Every week, I release new content focused on health, aging, and safety for adults over 60. And your engagement helps these videos reach more people who truly need this information. Now let us move to number 2, and this point catches people off guard almost every time. You must know the symptoms well enough to react immediately, because with hantavirus, the gap between early illness and a medical emergency can be incredibly short. Here is the pattern you need to recognize. If someone develops a fever above 101 degrees, combined with muscle aches, especially in the thighs, hips, or lower back, and then begins experiencing increasing shortness of breath after possible rodent exposure within the last 1 to 8 weeks, that situation should be treated as an emergency. Do not wait several days hoping symptoms improve. Do not assume it is just the flu or pneumonia. Go directly to an emergency room and clearly tell the medical team about the possible rodent exposure. Say it directly, mention hantavirus specifically, and explain where the exposure may have happened. Never assume busy hospital staff will automatically connect those details themselves. Early recognition can make an enormous difference. Studies have shown that patients whose exposure history was identified early often had better outcomes because they received specialized supportive treatment much sooner. Some severe cases may require advanced life support systems such as ECMO, a machine that temporarily helps oxygenate the blood when the lungs can no longer function properly on their own. There is another reason older adults must act quickly. As the body ages, the immune response becomes more unpredictable. Researchers sometimes describe this as inflammaging, where inflammation and immune signaling become weaker in some ways, but more chaotic in others. That means an older adult may actually feel less sick than they truly are during the early stages of a dangerous infection. Never ignore worsening breathing problems simply because the symptoms do not feel dramatic yet. And now we come to the number 1 most important step every adult over 60 should take this week. Have a direct conversation with your doctor about your personal hantavirus risk before you clean rodent-prone spaces or spend time in areas where exposure is possible. It may not sound dramatic, but this one step can be incredibly powerful. Surveys have shown that very few older adults ever discuss diseases transmitted from animals with their healthcare providers. Yet your doctor can help assess your personal level of risk in ways most people never consider. Certain medications, including some steroids, antihistamines, and blood pressure medications, may affect immune function. Your physician can review your medical history, identify added vulnerabilities, document your exposure risks in your records, and help ensure faster recognition if you ever develop symptoms later. There is currently no approved vaccine for hantavirus and no preventive antiviral medication available. That makes preparation and communication extremely important. Your doctor can become an early warning system and a strong advocate if serious illness ever develops. Bring up the topic directly during your next appointment. Explain whether you spend time in cabins, sheds, barns, garages, gardens, or rural properties where rodents may be active. Share concerns openly and ask what precautions make the most sense for your specific health condition and age. If possible, combine that doctor's visit with the rodent inspection we discussed earlier, so you can provide clear details about your actual exposure risks. Prepared patients are often taken much more seriously because the information is specific and actionable. And here is the most important thing I want you to remember after watching this video. You are not powerless against this virus. Knowledge changes outcomes. Most people still know very little about hantavirus, but now you understand how it spreads, how rapidly it can escalate, and what actions truly matter. You know to inspect enclosed spaces carefully. You know to use proper protective equipment. You understand why wet cleaning is critical. You know the warning symptoms that demand emergency attention. And you understand why involving your doctor early could potentially save your life. These are not expensive or overly complicated steps, but they are meaningful ones. They allow you to continue enjoying the independence and activities that matter so much later in life. Whether that is working in your garden, cleaning a family cabin, organizing your garage, or spending time outdoors safely. It does not matter if you have cleaned rodent-infested spaces for decades without thinking twice about it. What matters is what you choose to do starting today. Small changes in awareness and preparation can completely change future outcomes. Longevity is not only about diet and exercise. It is also about recognizing hidden risks before they become disasters. Hantavirus is one of those risks, and now it is something you understand and can actively protect yourself against. If you found this video helpful, make sure to subscribe to NanoNexus Science and turn on notifications so you do not miss future videos focused on health, safety, and healthy aging for adults over 60. And now I would really like to hear from you. Have you ever cleaned an area with rodent droppings without wearing protection? And what part of today's discussion surprised you the most? Leave your thoughts in the comments because I read them all, and many future topics on this channel come directly from your feedback. Thank you for watching and for spending your time here with NanoNexus Science.